In the absence of skin lesions, alternative specimens, such as oropharyngeal, anal, or rectal swabs, can be tested, though these are less commonly used. Blood tests are not recommended for diagnosing Mpox, as the virus is not typically present in the bloodstream. Serological tests that detect antibodies to the virus are available, but they are not useful for distinguishing between different orthopox virus infections, such as smallpox or cowpox. These tests may have limited diagnostic value and are not routinely used in clinical practice. Transmission Mpox is a zoonotic disease, meaning it can be transmitted from animals to humans. Transmission from animals to humans occurs through direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. Activities such as hunting, skinning, trapping, and consuming bushmeat, as well as handling animal carcasses, are high-risk behaviors for zoonotic transmission. Person-to-person transmission of Mpox occurs through direct contact with infectious lesions, scabs, or bodily fluids. This includes skin-to-skin contact, such as touching, kissing, and sexual contact, as well as face-to-face interactions that involve respiratory droplets or aerosols from prolonged close contact. The virus can enter the body through broken skin, mucosal surfaces, such as the eyes, mouth, and genitals, or the respiratory tract. Mpox can also be transmitted through indirect contact with contaminated materials, such as bedding, clothing, towels, or medical equipment. In healthcare settings, sharps injuries pose a risk of transmission, particularly if the virus is present in blood or bodily fluids. During the 2022 to 2023 outbreak, a significant number of cases were reported among men who have sex with men, MSM, particularly within sexual networks. This led to increased awareness of the potential for sexual transmission, although Mpox is not classified as a sexually transmitted infection, STI, in the traditional sense. However, the high concentration of the virus in skin lesions and bodily fluids means that sexual contact can be an effective mode of transmission.